Assalamu alaikum wa rahmatullahi wa barakatuh. Hi everybody. Today, inshallah, our lecture about the bones of the thoracic limb in domestic animal. As you know from the introduction, that is the endoskeleton consists of two parts. The axial skeleton, which include skull, sternum, vertebral column, and appendicular skeleton, which consists of forelimb and hind limb. So today we'll speak about the bones, the osteology of the thoracic limb. So the objective today speak about the bones of thoracic limb in domestic animal, to compare between the bones of different animals, and also to know the specific feature in each bone of the thoracic limb, and to state clinical correlation of the bones of the thoracic limb. So if you look at this diagram, you will see the bones of the thoracic limb or forelimb, scapula, humerus, radius and ulna, and the carpus, metacarpus, and digit. And you know the area from the carpus until the distal phalanx, known as the Menos region in the forelimb. Also, you can see the joint of the thoracic limb, which will be discussed later on the special arthrology. So you have the shoulder joint, and then elbow joint, and then carpal joint, and then fetlock and pastern, and then finally the coffin joint. Also, if you can look at this diagram, in case of ruminant, you can see scapula, humerus, radius and ulna, and the Menos region, and you can know the different between the bones of different animals in terms of the like scapula and humerus. So each animal has a specific feature. So let us start now by the as you know, the thoracic limb, we have region and bones. For example, the shoulder girdle is formed by certain bones, and then we have the arm region, and then forearm region, and then Menos region. So the shoulder girdle has a scapula, which is this one, and then coracoid, and then clavicle. So it is interesting to know that the shoulder girdle is fully developed in birds because it includes the three parts: scapula, coracoid, and the clavicle. However, and also in case of the human, however, in case of the mammals, you will find that coracoid is reduced into coracoid process of the scapula, right? And the clavicle itself is absent, in the animal horse and ox. We have clavicle is absent, or be rudimentary bone embedded in the brachiocephalic muscle. Also, it is interesting to see in the cat, the clavicle is present but non-articular, and this is why if you make X-ray in the cat, don't confuse between the fracture or part of the bone and the clavicle, because you will find is a piece of bone which is non-articulated. So you have to know that is normal in case of the cat. Then you have the arm or brachium, which has the humerus, and then forearm or antebrachium, which is radius and ulna, and you can see the forefoot or Menos region has carpus, metacarpus, and then digit. Digit has in equine 3 phalanges and has 3 sigmoid bone, 2 proximal sigmoid bone, and 1 coffin in the coffin bone, which is called navicular bone, right, or distal sigmoid bone, present in the coffin joint. So the first bone is scapula. It's interesting to know you have to know the type, position, direction, and shape, and then description of the each bone. So scapula from the introduction is a flat bone, and it is present in the anterior part of the thorax in the lateral wall, and the direction of the scapula will be cranio-ventrally, and is triangular in shape. So scapula itself, you can see from the diagram just now, you can see if you look at the diagram here, for example, in case of the equine, you can see now he has lateral cervix, and then we have the lateral cervix, and we have the costal cervix, and then lateral cervix. Now you can have as a triangular shape, we have 2 cervices, lateral surface, and then the costal surface. And we have three borders: cranial border, caudal border, and dorsal border, which carry scapular cartilage. And we have three angles, which is cranial angle, caudal angle, and then we have the ventral angle. So if you look at the text now, you can see we have a spine of scapula, and then we have the tubercle of spine, supraspinous fossa, infraspinous fossa, neutron to foramen, and then we have costal surface or medial surface, which has subscapular fossa and the fascia serrata, and then we have acromion. Let us go back now to see the diagram. See, this is the spine of the scapula right here, which divided the scapula into two fossae. This one is supraspinous fossa, which is important for for the supraspinatus muscle, and we have infraspinous fossa for infraspinatus muscle, and the ratio in case of the equine is unequal. Also, is interesting to know we have here the glenoid cavity of scapula is important as articular depression for the shoulder joint, and then we have the supraglenoid tubercle, and also we have the coracoid process. If you look at now the costal surface, you can see the fascia serrata for serratus ventalis muscle, and then you have subscapular fossa for subscapularis muscle, right? And the ventral angle is interesting to know in equine we have the glenoid cavity, which has notch. So the only animal you can see has glenoid notch would be in case of the equine, and then you have the supraglenoid tubercle, and then you have here the coracoid process. So this would be the coracoid process. You can see now when the spine of the scapula is ended, so there is no what is called acromion process. So now if you look at, this is the scapula of the bovine. You can see now the same as in case of equine, except the ratio between supraspinous and infraspinous fossae different, right, from the equine. Also, you will find subscapular fossa different in terms of the how much is deep. And interesting to see serratus face here for serratus ventralis, and this is the dorsal border for attachment of the because the scapular cartilage would be in this area here in the dorsal border. One is interesting to find that here we have what is called acromion. So in equine, if you look back here for equine, there is no acromion. However, in case of the bovine, you can see this acromion right here, right? So the spine of the scapula, which ended by acromion. All right. If you look at now, in case of camel, you find camel also has acromion, and also you can see now, in case of the ruminant, also we have acromion in ruminant before, and then we have also in the dog has also acromion. So dog has acromion or acromion process. You can see acromion or acromion process, and also camel has one, and also bovine has, but it is absent in case of the equine. This is just for your information. Just the sheep here is you have to know sheep, right? Because sheep is just similar to the equine, similar to the bovine, right? Pig now is a little different because it has large spinous tuber, or tuber spine will be large in case of the scapula of the pig, and you'll find also spine is curling caudally over the spinous fossa. But this is just in pig for your information. Again, if you look at here, this is the scapula of a dog. So you can see now the borders, cranial border, caudal border, the spine of the scapula, and it has acromion in case of the dog. Also this one acromion dog, and you can see now that is the ratio between the two fossae, supraspinous and infraspinous, usually equal 1:1. You can see also fascia serrata, you can see subscapular fossa, and you can see also acromion and glenoid cavity, but it has no notch in case of the dog. So this is important table to see the comparative between the different domestic animal. You can see the ratio between supraspinous and infraspinous is different. You can see from 1:2. in horse or 1-to-1 in dog. A tube of spine would be very clear in case of the horse. Acromion is present in animals except in case of the equine absent. Glenoid cavity would be oval in horse. Glenoid notch only present in the equine. Subscapular fossa will be deep in the equine, and then we have the nutrient foramen. Second bone is the humerus. Humerus is an important bone to form the brachium region, and usually between the shoulder joint and raise and ulna between the elbow joint. It is a long bone. It is present between shoulder and elbow joints, is oblique, distally, and caudally, and usually it has a shaft and 2 extremity. The shaft has important structure known as musculospiral groove for brachialis muscle, has teres major tuberosity for latissimus dorsi, and the teres major muscle has a humeral crest and deltoid tuberosity for the deltoides muscle, and the teres minor tuberosity for the teres minor muscle. Proximal extremity has head, has greater trochanter, lesser trochanter. We have a bicipital groove, and then we have this extremity. We have medial condyle trochlea, and lateral condyle is the capitulum, and then we have medial and lateral epicondyles, and then we have coronoid fossa and the olecranon fossa, right? So now if you look at this diagram, is nice diagram for the equine. So you can see now for the caudal view, we have the head, and then we have the greater trochanter, which has cranial part and caudal part, and then you have cranial also. Lesser tubercle also has cranial part and the caudal part. You can also see the deltoid tuberosity. You can see also the the epicondyles, lateral epicondyle and medial epicondyle, and between them we have the olecranon fossa. If you look at the cranial view now, you will see the bicipital groove, and bicipital groove or intertubercular groove, and it's interesting to find that it has ridge in case of the equine known as intermediate tubercle, and this is only present in the in the equine, and this tubercle divided the bicipital groove into 2 parts. Also, we have a radial fossa, right, cranially, and then we have the condyle. We have the medial condyle is a larger one. It's called medial condyle or trochlea, and then the small part here would be the lateral condyle or capitulum. Also interesting to find, also here we have the lateral epicondylate crest, right, in the cranial aspect. So you can look at also here in case of the bovine. Interesting structure to find, that is the cranial part here, right, of the tuberosity usually curved over the bicipital groove. Another one for bovine, you will see the head, right, this is it should be humeral head, right, humeral head, and then you have intertubercular groove, right, which is undivided here. You can see also the greater tubercle is curved over the bicipital groove, right. You can see also the olecranon fossa, you can see the radial fossa, you can see the trochlea, you can see the capitulum, and also you can see also the bicipital groove. If you look at the humerus in the dog, you can see also the head, the trochanter, the trochanter and this are trochanter, teres major tuberosity, deltoid tuberosity, and we have also epicondyles. Interesting structure in the dog, that is the 2 fossae are communicated together to form what is called supratrochlear foramen, and supratrochlear foramen usually is empty space, so nothing, no structure passing through the the supratrochlear foramen. However, in cat we have what is called supracondylar foramen, and usually have like brachial vessels, right, will be passing through the, and the median nerve passing through the supracondylar foramen in case of the cat. So this is an interesting table to know the comparative anatomy of the humerus. You have to read it carefully to know the intertubercular groove. Usually, as we know, in equine is divided, will be undivided in other animal. The lateral medial tuberosities will be divided in case of the horse and ruminant, and divided in dog. The deltoid tuberosity will be more prominent in the equine, and the coronoid fossa and the coronoid and radial fossa. You can see coronoid or radial, and olecranon fossa. Interesting to find is communicating in case of the dog to form what's called supratrochlear foramen, which is empty in case of the dog. However, in the cat, we have what's called this is supratrochlear in dog, but in cat known as supracondylar in the cat. And we have some structure passing through the supracondylar foramen in the cat, which is the median nerve and the brachial vessels. Then now we speak about radius and ulna. Is a long bone. Start by radius. Is a long bone right between humerus and carpus. Is vertical. Has also body and two extremity. Right. It's important to know it has glenoid cavity, sagittal ridge, coronoid process, and synovial fossa. And we have three tuberosities: radial tuberosity, medial tuberosity, and lateral tuberosity. This extremity, we have three grooves for the extensor muscle, and then we have the palmar cervix or caudal cervix has transverse crest, and then we have carpal articular cervix to articulate with the first row of the carpal bone. So we have medial styloid process for radial carpal bone, right? And then we have the lateral styloid for ulnar and dexter carpal bone. And then we have the middle facet for intermediate carpal bone. Ulna is reduced bone and also vertical. What interesting is ulna, usually it doesn't carry much weight in the animal, right? Doesn't carry much weight of the animal. This is the ulna, right? It has an conial process or beak, has a summit, which is the olecranon tuberosity, and this is important for attachment of certain muscles such as triceps brachii, tensor fascia antebrachii, and the anconeus muscle. Distal end usually forming the lateral styloid process of the ulna. So if you look at this one here, diagram of the equine, you can find the ulna fused with the radius and leaving interosseous foramen. In case of the camel is interosseous space in the horse, interosseous foramen in the camel, and the two interosseous spaces in case of the ruminant, and separated in case of the dog. You can see also here in case of the if you look at here, in case of the bovine, you can see the radius and ulna communicated, leaving one proximal and one distal interosseous space, and the distal end of the ulna forming what is called styloid process of the ulna, right? And also radius has a styloid process of the radius, as we mentioned, is important to articulate with the first row of the carpal bone. You also look at here the anconial process of the ulna, and also trochlear notch, this one, and also the olecranon tuberosity of the ulna. You can see now in case of the dog, they are separated, and if you remember, separation of radius and ulna in case of the dog allow the animal to move to make supination and pronation. So you can see now the radius right here has head, and the distal end has a medial styloid process, which is a styloid process of the radius, and then we have the ulna, which in dog has anconial, and we have olecranon, right, and we have coronoid process, which is medial one and lateral one, and you can see also we have lateral styloid process of the ulna. Also, it's interesting table to compare between different animals. You can see it's partially fused in case of the partially fused in case of the horse, will be completely fused in ox and sheep and will be separated. And as we mentioned, supination and pronation because because separation. This one in the radius, we can see the fusion, partially fused, completely fused, and also you can see different part of the radius. The menos region, usually it is the carpus, metacarpus, and digit, right? So, it is two rows, proximal row and distal row. Proximal row is the names, so radial, intermediate, ulnar, accessory, and then we have the distal row is numbered first, second, third, and fourth. And you remember this one, this structure forming, palmarily, the carpal canal, which is important for, median palmar artery, median palmar nerve, and for superficial and deep digital flexor tendon within the sheath. So if we compare between the number of the, the number of the carpal bones in case of the equine or horse between 7 and 8. Why 7 and 8? Because the first one sometimes absent, and this why 7. If it is present, will be 8 carpal bones. In case of the in dog and cat, 7. Why 7? Because the radial and the intermediate fuse to form radiocarpal bone. Right? In case of the ox, usually, right, if you look at, would be 6, because the first carpal bone is absent, and second and third is usually fused in case of the, as you can see right here in ox, you can see second and the third are fused. If you count 1, 2, 3, 4, 5, 6 in ox, 7 in dog, and 7 or 8 in equine, and will be in pig. Usually the 8 carpal bones are present, mean the first one also present. This one a diagram to show you the carpal bones in case of the is the of the equine, and you can see also here the accessory carpal bone, and also you can see the different carpal bones, right, in case of the dog. Also this in case of the bovine, you can see now the first one absent, second and the third are fused in case of bovine. Metacarpal bones. Metacarpal bones, it differs according to species. So in case of the equine, we have 3 metacarpal bone. We have second, third, and fourth. The major one is the cannon bone, is number 3, and the splint bone, the reduced bone, will be number 2 and number 4. Usually the count starts from medial aspect, so we can count from medial aspect 2, 3, and 4. In the back of this bone, we have what is called metacarpal groove, which is important for suspensory ligament. And this bone has proximal extremity or base, which has undulating articular surface, and also have metacarpal tuberosity. In distal end, it has 2 condyles separated by a ridge. So now if you look at this one, you can see this one, the third metacarpal bone in the equine, and this is splint bone number 2 and number 4. And in the palmar aspect here, you find the metacarpal groove, which is important for suspensory ligament attachment, right? And you can see also there's 2 facets to articulate the second with the third, and 1 facet laterally to articulate between the third and the fourth, metacarpal bones. In case of the sheep and ox, also the 3 metacarpal bones, but the number difference. So because how it has declo in case of the bovine, so you will find they have metacarpal bones number 3 and number 4 are the major one, which are fused, right? Fused between number 3 and number 4. And number 5 would be the splint bone. Interesting to know that as they have 2 canals, and they have also a vertical vascular groove, right? So if you look at this one in case of the bovine, you can see this is the 3 and 4 metacarpal bones fused. We have metacarpal tuberosity, and we have the metacarpal canals, 1 proximal, 1 distal, and we have groove in between. And that's why you can see, because it has declo, and this is why we have 3 and 4 are separated distally for attachment of the phalanges, right? In camel, it's the same as bovine, but will be more divergent here, right, in case of camel. In canine, we have 5 metacarpal bones, right? But you can see now 1, 2, 3, 4, and this is the number 5. Usually number 5 is reduced and known as declo. In a pig, we have 4 metacarpal bones, right? Because the first one usually absent, then we have 2 and 5 reduced, and the 3 and 4, right, weight bearing, mean the developed one. So 3 and 4 in the pig as the main one, similar to the bovine. 2 and 5 reduced, but in case of bovine it was only number 5. Right, digit now in equine has 3 digits, right? 3 digit plus 3 sigmoid bone. We have, you look at here, this is the proximal sigmoid bone, 2, and then we have the first phalanx, and then the middle or second phalanx, and then the third phalanx, and then we have the navicular bone here at the third of the sigmoid bone. So we have 2 proximal and 1 distal. This distal one known as navicular bone in case of the equine. You can look at also here, right, in X-ray. You can see the you can see, look at the proximal sigmoid bone, and then we have distal sigmoid bone or navicular bone also right here. We have a proximal phalanx, which is like a long bone, and we have middle phalanx, which is like a short bone, and usually it has extensor process for attachment of the common digital extensor tendon. Distal phalanx, here you can see, if you look at this one, you will find this one, the first one, the second, the third one is important, because if you look at the solar aspect here of the third phalanx, you will find here we have flexural surface, right, and then we have solar surface, and we have solar groove and the solar canal for termination, right, of digital arteries. Also look at here, you can see we have 2 extensor process, and then we have 2 glenoid cavities to articulate with the distal end of the second phalanx, and then we have this one area would be articular area for articulation of the this sigmoid bone or navicular bone. Canine has 5 digits, right? But as we know, the first one is the declo, which, and so from 2 until 5, right? The dog has, each one from this one has 3 phalanges. But the first one, because the declo only has 2 phalanges, which is the proximal one and distal one. As we mentioned, horse has 3 sigmoid bone, 2 proximal and 1 distal. However, in case of the dog, we have 9 sigmoid bone. So the digit 1 has 1, and then 2 sigmoid bone for each digit, about 9, 9 sigmoid bone in each part, on each forelimb. Bovine and pig, right, they have 4 digit. 4 digit, but you can see that, the main ones would be number 3 and number 4 as the main ones, but the declo vestigial one would be number 2 and number 5. Also, there's phalanges, proximal and middle and distal phalanges, similar to the, the equine, and also sigmoid bone, similar to the equine, 2 proximal and 1 distal sigmoid bone, especially as an equine. So if you look at here, this is in the ox, you can see the 2 proximal sigmoid bone right here, and then we have the distal ones right here. This is in case of the pig. You can see also the declo number 2 and number 5. So how it is important to know? Of course, you have to know the bones in case of the forensic medicine, and also we have some correlation related to the bones of the forelimb. So for example, scapula can be fractured, especially different part of the scapula, such as the body, spine, acromion, glenoid cavity, supraglenoid tubercle. All this can be damaged. Also, it can affect, long standing can affect the make suprascapular neuropathy about the nerve damage, and also can have osteoarthrosis. Humerus important, can be fractured, and as you know, if you when you study the course of the iridial nerve in the forelimb, you will see any fracture of the humerus, especially the shaft, it can lead to damage of the iridial nerve, and as you know, the nerve supply the all extensors of corpus and digit, then can lead to knuckling, mean the animal it can walk in the dorsal aspect of the foot due to damage of the iridial nerve. Also, an ulna can be fractured, as you can see here in the in the X-ray. You can see can be damaged also as an ulna. Also, carpal bones can be damaged. Also, metacarpal bone can be damaged. Maybe the trauma or kicking between animals. Also, splint bone can be damaged, fractured, and also can be inflamed. And also, distal phalanx of the equine could be also be damaged. Just some interesting that to know don't mix in X-ray. If you do the X-ray, don't mix between the fracture and the sigmoid bone, right? Especially as the extensor carpi obliquus. In ruminant, as we know, number 5 is a small splint bone. So if you do X-ray, don't feel it is a small bone. So don't mix it up between the fracture of the metacarpal bones or metatarsal bone and the number 5, which is splint bone. Also, we mentioned that there's somewhat's called proximal and distal canals in the metacarpal metatarsal, and the connection between them will be a longitudinal groove, so it will be like opaque area. So don't fuse between X-ray. Don't confuse about the fracture. Is already, if you look back here, between the proximal. So don't confuse that will be the here the line here is will be opaque between the two canals is groove. So don't confuse that is a fracture. It's not a fracture. Is the connection between the third and the fourth metacarpal bones. Also, as you know, bovine is a duclo. Then you have lateral one and medial one. Lateral one usually number 5, and medial one is number 3, because we know 3 and 4 is the main ones in bovine. But the lateral one, number 4, usually carry more weight. So if any problem in damage, right, of the bovine and bovine leg, and you have to make amputation, it will be bad prognosis, right? If you make amputation for the lateral one, because most of the weight would be carried on the lateral, digit. So medial one can be okay, but maybe good prognosis. But to make amputation of the lateral one, it will be a problem and it can lead to poor prognosis. Thank you so much. I hope you understand, and please feel free to ask me any questions or clarification in the comment, and take care. Assalamu alaikum wa rahmatullahi wa barakatuh.